The UK's first academic palliative care department, established at King's College London, is celebrating its 10th anniversary, and it's still leading development in this relatively new area of medical research, both at home and overseas. So what is palliative care and why is it so important?
Palliative care is concerned with the care of people who are affected by life-limiting incurable disease, and we're interested in caring for patients right from the point of diagnosis all the way through to the end of their lives, and then for their family members into the bereavement phase. And we're not just interested in the patient, we're interested in their family members and their loved ones who are supporting them.
So, Ian, we need to discuss the study.
As modern medicine has become more focused on narrow specialty and fighting specific illness, it often seems that the patient themselves can become a bystander in their own treatment regime. Palliative care swims against this tide as it seeks to address the wider needs of both the patient and their family and close friends. In this respect, palliative care is often seen as the poor relation of medical research, as it's not perceived as curative or making groundbreaking advances in medical science. But its work is increasingly important. There are many illnesses that are degenerative or are accompanied by complex symptoms, such as multiple sclerosis, HIV or cancer. And at a time when in many societies populations are living longer, we increasingly need to learn how to manage the long-term illnesses that affect ageing populations.
To be done too, rather than have a voice in terms of what care they were given.
Our work is concerned with people's symptoms, their problems, and in particular in testing and discovering ways to help that. So it might be new treatments, for example, to manage breathlessness, which we're doing work on, or it might be looking at how services work to help people be cared for in their place of choice, or it might be looking in more detail at what people want or need.
In setting up the original department, King's College London recognised the importance of creating palliative care as an academic discipline. The research they undertake focuses on the total care of patients whose disease is not responsive to curative treatment and has grown out of the hospices that came from the work of Dame Cicely Saunders, increasing in importance as health professionals have come to appreciate the diversity of problems this approach to patients covers. In the world of palliative care, the control of pain, of other symptoms and of psychological, social and spiritual problems is paramount. King's College London has been particularly successful in working with a number of partner organisations around the world to help develop better tools to monitor and improve care for patients and their families. Being a leader in this field of research, they've been able to make significant contributions.
South Africa is probably the place that is leading the field in palliative care and HIV, the actual delivery of care. But we, because of human resource constraints and time constraints, we're not actually researching and writing it up. And so the association with King's came around how do we do effective research, how do we publish our work, and Richard has made the outreach to Africa, and we're in a collaborative research project at the moment looking at how palliative care enhances the quality of life of patients in African hospices, and we've got 5 sites in Africa, 4 in South Africa and 1 in Uganda.
Because of the HIV/AIDS epidemic, it's in countries like South Africa that it becomes easy to see the value of a discipline that looks outside the immediate medical problems of the individual to consider the requirements of the family and the community as well as the patient's wider spiritual and social needs. HIV/AIDS impacts on the community as much as the individual, and the need for a structured approach to solving problems of orphaned children and overburdened families gives some idea of how important the research of King's Palliative Care Department has become. Now, as this groundbreaking department approaches its 10th anniversary, plans are coming together for a new Institute of Palliative Care at King's College London. Named after the founder of the modern hospice movement, the Cicely Saunders Institute for Palliative Care will take the development of palliative care to new levels, extending current training courses and expanding King's commitment to innovative research in this field.
Medicine has become much more technological and focused on bits of people rather than on the whole people, and it's been very focused on cure. If we go back to more earlier times, then it was said that medicine would cure sometimes, relieve often and comfort always. And I think palliative care is about rediscovering the relieving and the comforting. And we would say that you should always relieve and comfort. And obviously you cure when you can.
In this new institute, teaching, research and clinical staff will work alongside each other, and dedicated space will provide open access patient and family support, all under the same roof, putting the human element back into the treatment of long-term patients.